Good afternoon. My name is Caliope Sarago, and today I'm going to be talking about the pre-ANDA meeting process and sharing best practices for submission of your product development and pre-submission meetings. Our objectives today will be to describe the purpose and scope of pre-ANDA product development and pre-submission meetings, to identify the best meeting pathway for your generic drug development program, and to discuss helpful tips for creating a successful meeting package. Pre-ANDA scientific meetings help facilitate communication between FDA and prospective applicants related to complex products and/or complicated drug development questions. These meetings are product development meetings, PDEV, and pre-submission meetings, PSUB. Additional pre-ANDA scientific meetings available but not covered under GDUFA 3 that may be more suitable for your program needs are also FDA EMA Parallel Scientific Advice Program, PSA, and the Model Integrated Evidence Industry Meeting Pilot, MIE. Keep in mind the PSA and the MIE meetings are not GDUFA meetings and are not subject to performance goals for scheduling and conducted GDUFA meetings. However, FDA does strive to ensure that we go by the timelines that we've established so that these meetings are handled appropriately. Control correspondence or product development meetings. So a control correspondence is another pathway that an applicant has to submit questions. But when should you submit a control correspondence versus a product development meeting? Control correspondences are for single or small groups of closely related questions. Generally, a single discipline will review your questions. These are generally out of the scope of what you would submit for a product development meeting. And responses are issued within 60 days for a level 1 or 120 days for level 2. For a product development meeting, this falls under a will or may grant situation, and I will explain that in a subsequent slide. Multiple or multidisciplinary questions are involved, and this also involves new information, data, or questions that are not suitable for a controlled correspondence. Your responses are issued within 120 days of holding the BDEV meeting being granted. Pre-ANDA program goals are to help clarify regulatory expectations for prospective applicants early in your product development. They assist applicants in developing more complete and focused submissions. They promote a more efficient and effective ANDA assessment process. And they help reduce the number of review cycles required to obtain ANDA approval, particularly for complex products. Product development meeting eligibility, will grant situation. A PDEV meeting will be granted if, in FDA's judgment, the requested PDEV concerns development of a complex generic product for which FDA has not issued a product-specific guidance or an alternative equivalence evaluation. The prospective applicant submits a complete meeting package, including a data package and specific proposals. A controlled correspondence would not adequately address the prospective applicant's response, and the PDEV meeting would significantly improve ANDA assessment efficiencies. For example, facilitate a generic development program via constructive feedback. A PDEV meeting eligibility may grant situation is when FDA may grant a product development meeting for non-complex products or complex products that do not meet the will grant situation and are dependent on available resource. If in FDA's judgment, it concerns complex technical and/or regulatory issues. For example, FDA has developed a product-specific guidance, and the prospective ANDA applicant is not proposing an alternative equivalence evaluation. The prospective applicant, again, must submit a complete meeting package, including data package and specific proposals. And again, a control correspondence would not adequately address these questions. The PDEV meeting would also significantly improve ANDA assessment efficiency. PDEV and PSUB meeting formats. PDEV and PSUB meeting formats can be requested in person, face-to-face, where core staff participate in person at FDA's White Oak campus. Additional attendees may participate virtually, making it a hybrid meeting format. An applicant may also request a video conference, where FDA and applicant attendees may participate from various remote locations via video connection with audio and visual communication. Presentation materials are projected throughout the meeting, and requests submitted as teleconferences will generally be changed to a video conference. For a PDEV meeting only, you may request a written response only as well. Let's review the PDEV meeting timeline. FDA will grant or deny your meeting request within 14 days of FDA receipt. Preliminary written comments will be issued no later than 5 days prior to your meeting date. Days to conduct the meeting or issue written responses only are within 120 days of FDA granting your meeting. The meeting length is 60 minutes, and meeting minutes are issued within 30 calendar days of the meeting date. Keep in mind, FDA can, at its discretion, grant you a longer meeting when we determine it may be necessary. And these meetings are may generally be for one of the meetings where you're discussing more something like a novel model integrated approach that requires a lot of data that you're going to be submitting and that needs to be evaluated. So again, at FDA's discretion, we may decide to grant you a longer meeting. Product development meeting request package. So do include specific and focused questions to allow timely discussion within 60 minutes. Do list questions clearly and concisely and group them by discipline for discussion. Do not request a comprehensive assessment of study protocols without specific questions. How can you avoid denial? Some helpful tips. Be specific and concise when requesting your questions by framing in a way that allows FDA to provide feedback, such as, do not ask, is the protocol acceptable? Avoid questions pertaining to assessment issues, such as, do not ask, is the proposed specification acceptable? Do not resubmit the same or similar questions already addressed in a control correspondence. These should be new questions or new data. Ensure your meeting package is complete and adequate information is provided to respond to questions, such as sufficient information on rationale, strategy for developing a specification, and ask for feedback on that rationale strategy. So let's move on to our pre-submission meetings. So the purpose of our pre-submission meetings are to provide prospective applicants the opportunity to present unique or novel data or information that will be included in the ANDA submission, such as formulation, key studies, justifications, methods used in product development, interrelationship of the data and information in the ANDA. This is your chance to orient identified FDA assessors in preparation for review of your upcoming ANDA submission and receive feedback on items or information that should be clarified. This is not meant for substantive assessment of summary data or full study reports and or not an opportunity to determine whether the ANDA is acceptable for receipt. This is probably the most important thing if you're going to take something away from the P-subs is this. So your P-sub meeting eligibility. FDA will grant a P-sub meeting if the prospective applicant was granted a prior product development meeting for the same complex generic product. If FDA believes in its sole discretion that a P-sub meeting would improve ANDA assessment efficiency. And keep in mind that the prospective applicant may request a P-sub meeting even if they did not have a PDEV meeting. In this slide, I'd like to summarize the P-sub meeting timeline. Once your P-sub meeting request is submitted, FDA will grant or deny your meeting within 30 calendar days of FDA receipt. FDA will hold your meeting within 60 days of FDA receipt date. FDA will issue preliminary comments no later than 5 days prior to your meeting. And the applicant has the option to submit a summary of that meeting within 7 calendar days of having the meeting. FDA will issue official meeting minutes within 30 calendar days of the meeting date. And we recommend that you submit your P-sub meeting request 6 to 8 months prior to your ANDA submission. P-sub meeting request package. Do include information on regulatory history, for example, prior PDEV meetings or CCs. Clearly identify main areas of focus for your P-sub meeting. What do you want to give FDA assessors a heads up on? Consider submitting your meeting package in a draft presentation format. Do not include technical questions. Technical questions should be submitted via a control correspondence or a product development meeting prior to submission of your P-sub meeting. Do not request written response only or teleconference meeting formats. So how do you avoid denial? Some helpful tips for a P-sub meeting. Do not include specific technical questions about your product development plan. Send those again in a control correspondence or in a PDEV meeting request. Clearly articulate the unique issues of your development program, which will benefit by giving the FDA a preview into your preparing your ANDA assessment. Moving on, once you've had your meeting, we've issued your meeting minutes, I'd like to talk about dispute of those meeting minutes. Prospective applicants requesting additional clarification of the meeting discussion should contact the assigned FDA point of contact. And this is generally your project manager in writing within 10 calendar days of receipt of your official meeting minutes. If the meeting minutes are determined to accurately and sufficiently reflect the meeting discussion, your point of contact will convey this information to you. If, after discussion, FDA deems it necessary to change the official meeting minutes, the changes will be documented in an addendum to the official meeting minutes. I'd like to share some resources. There's quite a few here, and these will be very useful for you for submission of your pre-ANDA and pre-submission meetings. So in summary, review appropriate resources and guidances before submitting your meeting request. PDEV meetings provide specific and concise questions and sufficient information on rationale strategy for developing a specification. Your PDEV meetings should be requested in person face-to-face, video conference, or written response only. PSUB meetings do not submit specific questions, but highlight the unique or novel aspects you want to present. Your PSUB meeting should be requested in person face-to-face or video conference only. And the PSA and the MIE are additional scientific meetings that may be more suitable for your product development needs. So that concludes, thank you, and I'll turn this over to Dr. Aran.